In this video, we will demonstrate sampling an abnormal area of the prostate using a transperineal approach under local anesthetic. John is a 74-year-old patient who was referred with raised PSA of 14. He had an MRI scan of his prostate, which showed an 11 mm focus of abnormality in the right peripheral zone of the prostate. The peripheral zone is the outermost zone of the prostate close to the rectum. This lesion was reported as Likert 4, which is an MRI score that indicates that the lesion is likely to be cancerous. The score ranges from 1 to 5. 1 and 2 refer to benign lesions. A score of 3 refers to some uncertainty between cancer or inflammation, and score of 4 and 5 indicates a likelihood and a high likelihood of cancer respectively. As you can see in the video, the lesion is first visualized in the cross-sectional view, as you can see here, and subsequently also visualized in the sagittal view, as shown on the right-hand side. Then the local anesthetic is infiltrated, as you can see. The needle is infiltrating the local anesthetic superficial to the pelvic floor muscles. Then the needle goes through the pelvic floor muscles, and then reaches the paraprostatic tissue and the neurovascular bundle, and then the needle is withdrawn. The needle is moved more anteriorly, and more anesthetic is infiltrated to provide an anterior cover. We always twist our probe medially to check that the urethra is safe, and more local anesthetic is infiltrated in the pelvic floor muscles, and the rest is infiltrated on the way out. The access needle is then inserted, as shown here, as far as the prostatic tissue. The targeted lesion is clearly seen on the sagittal view in this video. And after positioning the access needle, the biopsy is fired, as you see, going exactly through the targeted lesion. This is also checked on the transverse view to ensure good targeting in terms of laterality. Another sample is obtained from the lesion of interest using the biopsy needle. This is also fired in a similar fashion, right in the center of the lesion. This is also checked again on the transverse view. And as you can see, the needle has gone through the lesion. The next biopsy will be taken more medially to ensure adequate distribution of the biopsy cause through the lesion of interest. After satisfactory position of the needle medially, the biopsy needle is fired through the lesion to obtain another satisfactory sample that is also checked on the transverse position to ensure adequacy.
This is the end of the video. I hope that you found it educational and informative. If you like the video, please consider liking, sharing, and subscribing to the channel to help its growth.